So the basic concepts of bone health are that the cells in bone build up bone throughout your life until you reach peak bone mass at the age of about 25. From the age of 35 or so, like many other things, bone starts to go downhill in terms of bone density in both sexes, with an accelerated period of bone loss around the time of the menopause in women. Now, bone is a dynamic organ. It's constantly being remodeled throughout life to take into account changing forces on it, and also to get rid of old bone that can become brittle. The basic part of bone is, the basic structure of bone is that it's a collagen-based extracellular matrix on which is deposited the bone mineral, which makes it hard, and that's bone mineral consists of calcium and phosphate crystals known as hydroxyapatite. That's what gives bone its compressive strength. So you can jump on it and your bone won't break. Now, the important things for building up bone and for keeping it are adequate protein, because that's the basis of bone, adequate calcium in the diet, and adequate vitamin D to help you absorb the calcium. There's not much calcium in most foods, and we're not very good at absorbing it without vitamin D. The vitamin D also helps phosphate to be maintained in the body, and remember, you need the calcium and phosphate to deposit the mineral. And then lastly, you need to bend the bone a bit. You need to exercise it. So bone being slightly deformed helps keep it there. It's a use it or lose it concept. Patients who are most at risk of impaired bone health are, one, those who've chosen their parents badly. There's a major genetic component to peak bone mass and to the rate of loss after that peak and the risk of fractures. But the people who are most at risk of not building up enough bone in the first place and then losing too much of it as they get older are those who haven't had good nutrition as children, who haven't had adequate calcium in their diet, who haven't had been able to get adequate vitamin D, and who don't exercise enough. Now, for most people, that won't be a huge problem. They won't know anything about it until they get to about over their 60s. That's when most fractures occur in the people who have poor bone for whatever reason. There's another peak around the time of early adolescence where kids who don't have enough calcium, who are a bit sometimes overweight, don't have enough vitamin D, they can increase fracture rates then. But the biggest problem for fractures and the falls that cause them are in people over 65. Vitamin D is a little bit of a misnomer. It is not strictly a vitamin in that there's not an awful lot of vitamin D in most foods in Australia. Fish, especially with the skin, seems to be a useful source of vitamin D. There's a little bit in eggs. There's some in mushrooms, especially if they've been exposed to UV. But mostly people get vitamin D from a chemical reaction in skin, where UV provides the energy for that reaction. So the people who have low vitamin D are those who can't or don't want to go into the sun. So these are older people, often if they're not well or if they're unable to move very easily. People who have to avoid the sun because of the higher risk of skin cancer. People who work too hard indoors. Just about every endocrine registrar that's ever been tested has been shown to be low in vitamin D. That's an anecdote. The other group are those people who don't expose their skin to the sunlight for religious or cultural reasons. So they include cultures that value white skin, like women of Chinese origin, and a lot of religious women, Orthodox Jews and Orthodox Muslims, cover most of their skin because of modesty. People who have very dark skin also tend to not have high levels of vitamin D, and there's a little bit of a debate as to whether that's because they don't go out in the sun or because the melanin absorbs the UV energy and makes it more difficult to make vitamin D. The other big group that we have to consider now are the babies of vitamin D deficient mothers. Now, they're born, they cry a lot, they don't thrive very well, and they can actually get the disease rickets that we thought disappeared in industrial England. Now, we're still seeing some of that in Australia, particularly in immigrant communities where women have either dark skin or cover up or both, and it's a real problem. Calcium and vitamin D work together, which is why most of the studies that have been looked at show that calcium and vitamin D together can reduce falls and fractures. Now, you need the calcium for the bone mineral, and we lose a little bit of calcium every day in the urine and in other places, and that has to be replaced. But if you can take a lot of calcium, but if you don't have the vitamin D, the active vitamin D, you don't absorb it. So that's a problem. The other thing is that calcium may actually help maintain vitamin D levels. There's a little bit of evidence that says that vitamin D is degraded more quickly if you don't have an adequate calcium intake. So between the calcium and the vitamin D, they both work for producing bone mineral, and the vitamin D is also important for muscle strength to reduce the risk of falls, because mostly it's falls that lead to fractures. Exercise is really important for bone and for muscle. Exercise maintains muscle, and that's important because as you get older, there's a tendency for muscle mass to decrease, as well as bone mass tending to decrease. Now, with bone, it's heavy to carry around, and so your body doesn't keep any more of it than it actually needs. So the sort of exercise that's useful is exercise that deforms bone slightly. That sends us a local signal to bone saying, we need this bone. If you're going to take away a bit for remodeling, we need to replace it. If you deform the bone too much, you will actually start a process whereby you build up bone. So if you look at the bone of elite tennis players, their playing hand is much thicker than their non-playing hand. Where it becomes really important is in the older ages. Weight-bearing exercise that deforms the bone slightly is really important. So that can be resistance training. It can be going upstairs. It can be walking, but if you're walking outside, you have to worry about the pavements so that you don't fall over, and that is a significant risk. If you're really short of time and you can do it, one of the best exercises is jumping up and down a little bit, because that really puts the weight on your bones and deforms them just a little bit, signals to the bone, we're all needed here, thank you, keep us going.
Most people are aware that dairy foods, in particular, are a good source of calcium. So milk, regular milk, is a great source of calcium. You can get low-fat milks, and in this country, the reduced fat or low-fat milks are generally higher in calcium than regular milk. So you get like a triple bonus. You're getting fewer kilojoules, you're getting less fat, but you're getting more calcium with the lower fat milks. Some milks are calcium fortified, but it'll be on the label, and you need to tell your patients, look for the label, because it'll state calcium fortified. And those will be at 2 to 3 times more calcium than you find in regular milk. So you're getting your calcium much easier in a lower volume of milk. But be aware that there's a lot of there's a lot of milk substitutes there on the market, such as soy milk, nut milks, oat milk, rice milk. Now, they will not normally contain calcium. So unless it actually states on the label, calcium fortified, calcium enriched, or high in calcium, then they will not have calcium. So make sure your patients know that they need to look for that on any milk substitute. Yogurt is a very good source of calcium because it's like a concentrated milk, and that'll have about twice the calcium content per volume as regular milk does, so a great source there. Cheese, hard cheese, a very good source of calcium because, again, it's a more concentrated milk source. But things like cottage cheese or ricotta cheese, although they contain calcium, it'll be lower than hard cheeses in their calcium content. Fish, Tin fish, particularly if you eat the bones of tin fish like salmon and sardines, if you eat the soft bones in there, that's where your calcium's coming from, and that'll be equally as good as a glass of milk when it comes to a serve of those kind of soft-boned fish in cans. Tahini, which is made from sesame seeds, is another good source of calcium, and so from tahini you can make dips like hummus, and that'll be another good source of calcium there too. Tofu, very popular again with vegetarians, but check the label. If it's what we call calcium set tofu, that means it'll have quite a bit of calcium. Not all of them will normally do that, but check for the label and see what the calcium content is, looking for about 70, 80 milligrams of calcium per 100 grams. Nuts, some nuts, almonds in particular are a good source of calcium. And of course, people ask the question, what about milk chocolate? Well, yes, okay, it does contain some calcium from the milk, but go easy on the milk chocolate. Well, you have to be careful when because there's a lot of people who make claims. For example, I make claims that spinach is a good source of calcium. You don't need to drink milk. Go for spinach, go for rhubarb because they're a good source of calcium. Look, they are high in calcium, but they're also, spinach and rhubarb are particularly high in oxalate. It binds the calcium, so you get calcium oxalate, and you cannot break that down. So in other words, the calcium will just go through the system and be peed out at the end of the day. So be aware that high calcium doesn't always mean a good source or a good bioavailability of calcium. On the other hand, broccoli and kale, you'll absorb about 60% of the calcium in broccoli and kale because they're low oxalate foods. And as I mentioned earlier, also be aware that that some of the milks, such as the soy milks and almond milks, won't be a good source of calcium. But people presume that. They just say, okay, well, if I'm not drinking milk, I'll go to, for example, an almond milk or macadamia milk, and they presume it's going to be exactly the same. But you must make sure that they understand that it has to be on the label calcium fortified. Vitamin D through diet is actually a tricky one. We generally only get about 10 to 20% of our vitamin D through our diet, normally on average, but it can be done. Canned fish, for example, will have vitamin D, such as your salmon, your tuna, your sardines, but also regular salmon, because it's an oily fish, will provide you with some vitamin D. Margarine in this country is fortified with vitamin D, so a tablespoon will give you around about 10% of your vitamin D needs. Milk doesn't normally contain vitamin D, but you can buy vitamin D fortified milk. You need to look on the label for that, and a glass of that will give you somewhere around about half, maybe a third to a half of your vitamin D requirements in the vitamin D fortified milk. Hard cheese will have some vitamin D. Egg yolks have some vitamin D as well. One thing that does surprise a lot of people is that mushrooms provide you with vitamin D. They're a little like your skin. If you put mushrooms out in the sun for a wee while, they'll generate their own vitamin D through UV light. We had mushrooms tested around the country, so we know that just regular retail mushrooms provide you with about 20-25% of your vitamin D. If you put them out in the sun for about 15 minutes in the summer and for about an hour in the winter, put them out in the midday sun, they'll generate all your vitamin D requirements just in one serve. So a serve is about 3 mushrooms or one big, large, flat mushroom, and that'll do it. Some of the farmers in this country right now are giving their mushrooms a special pulsed UV light treatment after harvesting. They just need 2 seconds of that kind of special light, and bang, they're going to produce all of your vitamin D requirements in one serve. So look for the label. It'll be on the label, vitamin D mushrooms. Okay, everybody knows about calcium and vitamin D. They're the critical nutrients, but like any biological system, it's not just 2 nutrients do the whole job. For example, magnesium, vitamin C, vitamin K, the B group vitamins are all particularly important for good, strong bone health. Now, you can get that through, for example, green leafy vegetables will provide you with things like magnesium, and they'll also provide you with some vitamin K. Everybody knows that vegetables and salad vegetables will give you your vitamin C. Nuts, seeds, legumes such as chickpeas or lentils will help you get all of your nutrients, particularly magnesium. So you can get a sense that really healthy eating is particularly important to get for good health as well as for your bone health too. Although of major importance, of course, is the calcium and the vitamin D.